Fox 13 has obtained emails sent to employees in the Department of Health and the Department of Human Services telling them there are plans in the works to merge into one big agency. These emails went to public health and human services workers informing them of a potential merger under Governor Spencer Cox's administration. Health Department Director Rich Saunders says, "We support the governor's vision, as do many legislators, and we want to help you understand what this means for the Utah Department of Health." Human Services Director Tracy Gruber writes, "The governor is not proposing to reduce the number of state employees as part of these changes. If the mergers are approved by the legislature and after studying combined agency functions, workforce reductions would be accomplished through retirements and regular turnover." A bill is being introduced in the legislature to merge the agencies. Representative Paul Ray says he's running it and there's advantages to combining them.
We've built these government silos when it comes to funding and work, and there's nothing being shared between the silos. And the thought is let's tear those silos down, let's combine them, combine our resources, combine our money, combine the knowledge that we have, and go forward and offer a better service to the citizens of Utah.
But the idea is facing pushback, especially during the COVID-19 pandemic.
I'm concerned that this is moving too quickly, especially in the middle of the worst pandemic in a century. I'm really concerned that distracting or diverting attention from these two huge agencies, from making sure that we're getting vaccines in arms and stemming the spread of this virus and making sure that the economic fallout of COVID is being addressed.
The Utah Academy of Family Physicians says it's moving too fast. In a statement to Fox 13, the group says the idea should be studied and the process should be transparent, but also not during the COVID-19 pandemic. Governor Spencer Cox supports the merger. A senior advisor tells Fox 13 he believes there are synergies by merging social service agencies and better results for those who receive services. The governor's office says merging the two agencies will not impact our COVID-19 response. The critical functions and personnel of the two agencies are retained. Public health will continue to be a robust piece of any agency merger. And speaking of COVID-19, earlier in the week, we showed you video of lawmakers getting rapid COVID tests to determine if there is a problem here on the Hill. It's required of all staffers, interns, and lawmakers. Senate leadership says they've now identified 3 cases. Those people are quarantined. As for how big of an outbreak there has to be before things shut down, the House Speaker says they evaluate that day by day. On the Hill, Ben Winslow, Fox 13 News, Utah.